Welcome to Tea with Tanya podcast. Every week, I'll be brewing up a perfect blend of public health stories, which will include maternal and reproductive health, career and academic advice, self-love, health, and wellness tips. Join me, your host, Tanya. I'm a public health professional working in maternal health. I'm a birth and postpartum doula, a placenta encapsulation specialist, and certified lactation counselor by day. And I'm your average tea-loving millennial and content creator by night. So pour yourself up a cup of tea and join me in the tea tasting room for your weekly dose of inspiration where you are the center of our conversation. This podcast is here to serve you. So come take a sip with me and let's start promoting positive living together. All right, guys, welcome back to another episode of Tea with Tanya. On today's episode, which I'm very excited to talk about, I'm going to be talking to two beautiful menstruating women about their period experience. And as you would have heard my period story, I still believe I have period trauma, but that's a whole different episode. We'll talk about it another day. But I am joined by someone really, really special to me. And I don't think I tell her enough how special she is to me, but she plays an integral part of my organization, Scrub Life Cares. She's a doctor. She's a beautiful soul inside in. And we're going to be hearing her period story, see what she got going on when she was growing up, what's going on with her now. And hopefully you guys can relate. But as we do here, I'm going to have her introduce herself and tell us all about herself, give us the tea about who she is. So take it away.
Tanya, you have me blushing. You've never spoken to me like this before.
I mean, I was just keeping it real.
So, hi everyone. And Tanya, that was really nice. But yeah, I pretty much met Tanya off of Instagram. So that's such a small world. And I told people in interviews that I pretty much joined this organization through a box that came on my kitchen counter. So that is how I found out about Scrub Life Cares. I say all of this to say thank you, and that my name is Michlene Zouetr, and I recently just graduated from the American University of Antigua as a doctor, and I will be pursuing family medicine residency coming this June. So a lot of exciting things for me in there. Interesting enough, a lot of people asked me what Scrub Life Cares is. In my interviews, and it was such a good thing to have. And like I told them, I directed them to the Instagram page, and everyone was just so, I want to say, for lack of better terms, they just loved the idea of what we could do as a nonprofit organization. So thank you, Tanya, for that, and thank you for allowing me to join and be a part of your team.
No, I appreciate it. You have me blushing here, but anyway. I need my jawbone to be working. I need my cheeks to be working. So I don't want to be smiling too much and then it locks up. So, so guys, like I said, we're going to be sharing our personal and maybe some funny stories about our period. So get ready to laugh, maybe cringe a little bit. Who knows? But I want to know, Michlene, or Dr. Michlene, should I say? Because we're going to put our titles on these people. But, do you remember the first time when you got your period?
Yes, I do. It was actually very weird. So it was New Year's Eve, and
oh Lord,
yeah, it goes there. It was New Year's Eve, and I was in 4th grade at the time, so I was 9 years old, and I didn't know a clue about what a period was. So I'm there, getting my hair done at the salon, and I'm pretty much feeling pressure in my lower abdominal region, and I don't know what's happening. My lower tummy, I have no idea what's happening. So I go to use the bathroom, thinking, it's going to be a BM. And then lo and behold, I go to the bathroom and I see something that I'm just shocked with. I'm like, what is this? Yeah. And so I called my brother and I was just scared. I was like, what is happening to me? What is going on? And he was confused just as much as I was confused. And my brother's 2 years older than me. So he's only in 6th grade and he has no idea what is going on. Neither do I. My mom comes home and I'm telling my mom what's happening. And she's like, why'd you tell your brother? No, you weren't supposed to tell your brother. And I'm like, what do you mean? What is happening? I had no idea. I was so scared. And I was just like, did I do something really, really bad? And then she sits me down and she tells me, well, Michlene, this is, and mind you, she's like speaking in Arabic because she doesn't know how to say these things in English. So my mom is Arab speaking, and she's just like saying all of this stuff. And she's like, well, Michlene, now you're a woman. Nobody can touch you. Don't make anybody. And this is me 9 years old.
Right.
I had no clue in the world what is going on. What even does it mean to be a woman?
At 9 years old.
Yeah. So it was like, what is going on? And then she sits me down and she's like, make sure nobody touches you in a particular area. And, she's just insinuating things, but not saying anything.
Right.
And I was just like, I have no idea what is happening, what is going on really and truly. And it was so scary because she took me into her room and she had this conversation with me. And I was just like, am I not supposed to like tell anybody like what's happening? And she's like, you're not supposed to tell your friends when you get your period. You're not supposed to tell anybody when you get your period. Like, that's it. Like, it's so secretive. It's whatever. You only tell me. And I'm just like, okay, all right.
That is crazy.
Yeah, it was a lot. It was a lot. It was just scary, more than anything, because I was like, I have no idea. I didn't know what any of that was at the time. And then she taught me how to put on a pad. She taught me how to like do those things. And I went to my New Year's party after that, pretending like nothing happened.
I think for me, I remember I was 11 years old. I think I had just gotten to high school. I think was I in first form? I thought I was in first form, which would be like grade 7 for those of you in the US or other parts of the world. And I remember because I was this nosy girl growing up. I cannot help myself. I'm probably still nosy to this day. I was very nosy. And I had an older sister, but I remember one summer when my mom, we were in New Jersey, she was having my youngest sister. And I just remember I was running up and down outside on this scooter and she was talking to my aunt and they were talking about how old they were when they got their periods. But they were talking in a way that was like kind of quiet. They didn't want me to hear.
Mm-hmm.
But like I said, I'm so nosy. I tell people all the time that my ears can bend corners. So I remember hearing them talking about it, but I would just pretend I didn't hear anything. And I got home that year. I think I went back home that September. And my mom stayed back in New Jersey because she just had my sister like a week before. And I was by my grandmother, and I had an older cousin who was living with me. She was much older, so she was already seeing her period. And I remember one day, because we used to live next to this basketball court in Sweets, and my grandmother still, before she died, she still lived there. And I was over there playing, because they had this basketball tournament. So I was over there running up and down with the other kids, and then went back home to use the bathroom and saw, well, obviously blood. And I was just like, what in the world is going on? But I had an idea of what it was.
Mm-hmm.
And I remember stuffing my underwear with some toilet paper
Yeah.
and not telling my grandmother, but running back over to the basketball court to tell my cousin. And then she took me to the shop in the village to go buy some pads. And then she showed me how to put it on XYZ. And, we didn't tell my grandmother. I don't know why. I don't know why we thought, we weren't supposed to tell her, but for some reason we didn't. And then my grandmother ended up finding out about said period because I went to school, and that's when my whole period trauma began. I went to school and I had a mishap. So I went to an all-girls school, but we were in our uniforms. And I remember there was this rule back in the day in school, like whenever a teacher entered the classroom, we had to stand up. To this day, I'm like, why are we standing? Whatever. So that's a whole different thing. But we had to stand up once the teacher entered the classroom. And I remember standing up, and one of my friends, and it might have been Sharita, Dr. Phillip, who's our director of education in Scrub Life Kids. I think she was sitting at the back of me, and they all just saw like the mess or like the blood on my uniform. So her and like a group of my other friends just like kind of circled around me and took me down to the bathroom. Had to wash my clothes out and all that different things. So that's like my first time seeing my period, And then the second time when I had my second, like I said, my grandmother ended up finding out, but we still didn't tell. I don't know if she told my mom, but I didn't tell my mom anything. And then when my mom returned to Antigua and I had my second period, I was in the bathroom and I just called her. I'm like, oh, here we go again. Because I didn't know about tracking and these different things. And I remember calling her, telling her, showing her my underwear, which is just so, like, why would I? That's so gross. I mean, what was I going to do? I remember showing her.
You're a child.
I remember showing her the underwear. And, she went to her room and she got the pads, and then she was telling me, in her mind, and she's probably going to hear it, she's going to be, girl, you lied to me. In her mind, she thought it was my first period. She showed me how to put it on, but it was just it was like this hush, don't tell anybody. It's like an embarrassment thing. I said, you're a big girl now. It's like, I'm not a big girl. I'm 11 years old, honey. What big girl am I? I am not a big girl. at all. But again, we didn't have that conversation about, okay, she said the same thing, don't let somebody touch you here, be careful. And it's just like, you're telling a child, what? Like a year ago, or months ago, you didn't tell me this.
Mm-hmm.
But then the minute we started seeing our period, you know what I mean?
Yep.
That's the first thing. That's the first thing you say. So how did you feel when you first started your period? Like after that, and after that talk, you went to your party for New Year's Eve. Like how did you feel after knowing that, oh my goodness, I'm bleeding for X amount of days?
To be honest with you, like after it happened, I just kind of went with the tune of it and just did it. But I didn't know what
Uh-huh.
exactly was happening until like my friends finally told me, like, yeah, they saw their period or they whatever. But it was just, how did I feel about that? I honestly,
I know I didn't have a feeling. It was that it is what it is.
yeah, there's not really much that you can after that talk. There's not really much that you can think about or say. It's just like, okay, what just happened?
Why are you telling me don't let anybody touch you?
Yeah,
What's going on?
yes. So it was pretty much like I was in my brain just like, okay, what exactly does any of this mean? Why is it that, and I'm like 9 at this time. So I have no, this is the
Mm-hmm.
thing. And then, so a part of me initially was like, okay, why is it like this? Why can I then not tell my brother? Like, what's the big deal? And then a part of me kind of just forgot about it because I'm a kid. So I just went back to my business and, just went and have fun, ran around, did my thing. But it was just, yeah, it was in that moment in time, it was just like, okay,
We had to just go with the flow.
yeah,
Well, what can we do?
yeah.
Well, what can we do? But it's just weird to me when I think back then, and even in today's society, that it's still that stigma. Oh, don't tell anybody. Or this person's not supposed to touch you, and all these other myths and misconceptions around periods. I mean, I get why when you think about symptoms, I get why they would say that to an extent. But then at the time when we were growing up was a different era.
Yes.
People were saying, oh, if you see your period, that was like a bad thing, or you were dirty, you weren't clean.
Yeah. I will tell you in religion, for like, we apparently, like, when you're seeing your period, you're not supposed to go and get the communion or something like that because you're considered,
Oh, really?
yeah, you're considered dirty, or like it's a reminder of your sins, something of that sort. And I was just like, okay, all right, sounds good. So, and we couldn't, like, so before I saw my period, I was allowed to go into the altar. And then when I started seeing my period, my mom told me I couldn't go into the altar.
Oh, that that happened in some culture. We you're either shamed or like you're excluded, which is probably in your case you were excluded from
Hmm.
going to the altar and these different things. Some people are celebrated in some parts of the world when it comes to their period for saying that they're so powerful. But I think I have heard that. I think I've heard, like, when you're on your period, you can't do certain things, or you're not clean, or if you're a married person, you cannot sleep in the same room. There's a lot of historical context surrounding menstruation, and it's also one of the things that we're trying to do at Scrub Like, is like to bring that historical context in, but also educate and just have a normal conversation. Because
Hmm.
even talking to you here, to be honest, I mean, it's what we do within the organization. But even talking to you, I'm like, oh my goodness, here I go talking about periods. People are going to hear me all over the world talking about it, when it's something that I do like talking about, and think we need to break that barrier. But again, it's the mindset. Because I was that person. I would talk about anything. Oh, my period is for 7 days. Oh, it's 9 days. I mean, no, I don't have that. Thank the Lord, because I cannot just deal with a 7 day cycle. But I guess it just goes back to just having that education, probably educating parents now how to introduce that topic. Because you were 9 when you saw your period. I was 11. I remember having a classmate who said that she started her period when she was 8 years old, and we all were like, 8 years old. And, we were in second form, I think, at the time, and we were like, 8, what? Because again, we could not fathom the fact that you were 8 years old
Right.
seeing a period. Like, it's crazy. And then, like, what do we know? How can we know that we're putting on the pads the right way? Like, it's so many different, like, it's so many different things. Like, how do I know that I'm putting on the pad the right way? How do I know? It's just crazy. But I do want to ask you if you've ever experienced, because we have all these other common reproductive health issues
Hmm.
that correlates with our periods. Or have you ever had any experience that was challenging related to your period?
So I will start off by saying that the fact that I am currently a doctor, pretty much, and like I was along the medical tract, this is why my mother has not killed me for talking about my periods that much. So
I like that. I like that.
I just want to put that out there first. I've also had a my period has in fact impacted me a lot throughout my life.
Oh.
And to start off, they were not easy. And it's been a journey. It's been a really long journey of just trying to figure out what's happening. So initially I was okay. I was fine. And then through my teenage years, for as far back as I can remember, I started having some really painful periods. So like the first, at least day before my period, I'd feel cramping, light cramping, nothing too much. And then when my period actually came, it was just hell. It was really, really bad. And it would last for anywhere from like the first 2 days. For about the first 2 days, I'd get really terrible cramping. And the first day was especially critical because that's the day when I could possibly vomit.
Ooh, okay.
So it would become so painful that I'd be puking and puking nonstop. And it was just like, can I just stop? Can this just stop? Can the pain just stop? So I'm in pain and I'm puking, and it's not the greatest experience. Sometimes I had to even go to the hospital because they couldn't control my puking. I'd be puking all day, down to the point where I'm puking stomach acid. And so it's just like, we need to get this under control. And I went throughout most of my high school years doing that. I remember one time I like did a cross country and I came back and I was like, oh no, I'm all sweaty and everything and I'm in pain. And I'm like, oh no, my period is coming. And within that next second, like as soon as like air hit me, I was vomiting because I was sweaty and I was in pain. And I was just like, I had just finished my cross country. It was a lot. And it's not the greatest. And so I'd be in and out of the hospital probably like almost every other month with that. And then it started to affect me because it wasn't just during my period. It was the week leading up to my period. I was not mentally, I couldn't focus. There was a lot happening. My brain wasn't there. And so I suffered from some of that PMS symptoms. And then after that, I decided in medical school to take care of myself because I was like, this is not normal.
Okay, so wait, not to cut you off. So you're saying that from as far back as your teenage years or as you can remember, you were dealing with it?
Yes.
And it wasn't until you got to medical school, which was how many years ago?
Probably 5 years ago, 5-6 years ago.
So you've been through your entire teenage
to early 20s.
To your early 20s experiencing these painful periods, throwing up, vomiting, all these different things pretty much every month. Okay, all right. Carry on with the story now. So as you got to medical school.
This is the thing. My mom thought it was normal. And I'm over here. No, I don't know if my mom thought it was normal, but I'm over here thinking it's normal. And she didn't really like press me to go to the doctor. She just tried to handle me during that time, tried to be there.
Yeah, because I had a friend too who had some similar experiences. Whenever she would get her period, we had to have, if she was sleeping by us, we had to have like a bucket or something for her to throw up in because sometimes she couldn't even make it to the bathroom to throw up. It was, oh my goodness.
I would sit by the toilet, have my blanket, sit by the toilet, and just, when I'm done with one round, I go back to the bed. Then go back again. It was just, it's not a great experience.
So, all right. So tell us, you got to medical school and you decided you need to take care of yourself, but you couldn't continue on like this. So what happened? Well, take us through the steps.
At the time, I was extremely stressed as well. So I went to a counselor who I was going to speak to her about all of these different things. And she pretty much directed me to see a gynecologist. And so I ended up going to see a family medicine doctor or so a primary care doc. And she's actually very invested in this. She's done a specialization in women's health. And she was actually telling me that this is not normal. You may have endometriosis. This doesn't sound right. You shouldn't be experiencing this. And meddled in with the severe dysmenorrhea, so the severe pain that I would have, the vomiting, and then the symptoms that I would experience before my periods. She even labeled it as premenstrual dysphoric disorder, which is even worse than PMS. So it was like all of those mood symptoms that would occur.
So for those who don't know what that is, can you just give us a brief explanation as to what that is?
So PMDD is just a very severe form of PMS, and it happens at least a week or two before your period, and you can get mood symptoms where you get very stressed out. You can probably even get cramping. You get brain fogs a lot. So for me, it was just anxiety, having difficulty sleeping. I get headaches, mood swings, irritability. It was within a split second, I was feeling a different type of way. And then I had really low energy, things like that. Those are a few symptoms that you could experience. So PMS, but just turn it up to 100. So I spoke to her and she told me that, we can help with this by putting you on some birth control. And I said, well, I don't really want to be on medications. And at the time, I'd spoken to all of my friends and they were on birth control. One of them even was having similar symptoms to me. So she was placed on birth control a while back. And I was like, you're on birth control? I didn't know that. And I'm over here like scared to take medications. Very ironic for a person who's a doctor. But I just didn't want to be on medicine for the rest of my life. And you don't have to be. That's the thing. You don't have to be on medications for the rest of your life. Your treatment regimen can change as you move along. I spoke to my parents. My mom was pretty much against the fact because she didn't want me to be on medications. But I made the decision and said, I'm going to do this. I'm going to try it. And I tried it and it's been working. It's been helping me to not have as severe cramps, to not be vomiting prior to. And honestly and truly, just having that established contact with my primary care really did a lot. It did a lot to be seen, to be heard, to to say that this is actually something that, this is not normal, but we can help you. Like, we can make this easier for you. That was life-changing from there. I've had a lot of great results from the birth control. I'm not going to say I don't have side effects. I get migraines, but it's just, it's better than what I would normally go through. And at least I'm more productive, and especially with the field that I'm in and having periods affecting your life. Like it's not the greatest.
Besides birth control, did they ever mention any other method of treatment? And the reason why I'm asking this, because, it's very controversial in society these days, where, the first thing a doctor will tell you, and I was speaking to you as a doctor too, but the first thing they will tell you is you need to be in birth control without probably trying to find other holistic ways of treatment. Granted, we know that, it's the results when you are to go on birth control with a condition like this, but, just for context and for people who may say, oh, just like you, I don't want to be on birth control because I'm hearing, again, myths and misconceptions around birth control. Because everything that we take in life, to me, essentially, is that there is going to be some sort of side effects, regardless. Like, you see a advertisement for diabetes medication and the many lists, so there's always going to be some sort of side effects. And that's how I try to look at certain things. Granted, I'll side eye something and I'll do my own research. But were you diagnosed essentially with endometriosis, or did they assume you were? Like, what was that?
It's a presumptive diagnosis. It was a presumptive diagnosis. So the thing is, you can't fully diagnose until you actually see it.
Oh, okay.
And that's mainly with like a laparoscopy, or you have to do surgery to actually look in and see. Or you could use other methods, but the most definitive meaning would be to do a laparoscopy and just kind of see it inside to look for the lesions. But we did talk about like just painkillers or like, using heating pads but I had already used all of those things. That's the thing. I went to her as a last resort because it was just becoming too much. We did talk about maybe using nausea medications around the time just before and using painkillers just before. And I did try that. I did try it for a little bit. Wasn't helping. It didn't help. I feel like there was some other factor that needed to be under control, and it was just not going to be the painkillers, neither the nausea medication. It was just something inside that needed to be under control. And I feel like the birth control really did help with it.
Okay. So for anyone who's listening again, from your personal experience, and I'll put in that disclaimer, even though I'm speaking to a doctor, we're not providing you with any medical
No.
services or anything. This is just for informational purposes. She's sharing her personal story, but also being in the medical field, she can talk to us from a medical standpoint. But anyone who's listening to this who may be wondering, because I know growing up, I had friends, like I said, they'll have heavy periods, or they'll have heavy periods, or a lot of cramping, or a lot of pain. And we just automatically thought it was normal. Oh, you're throwing up. Oh, that's normal. I'm just not throwing up because, what, my period. It's just so crazy, the things that we would think. I know for me, when I started, I was like, oh, that cannot be normal. I'm like, I may just be that 1% who did not throw up during my cycle, but I did have experiences in my younger years with cramps. I mean, I don't know. I mean, that could be a reason as to birth control as well, but I don't have that now. But to anyone who's listening, where it doesn't matter your age and you're going through thinking, okay, I'm having heavy periods, this could be normal, or this is what I'm supposed to experience. Because I remember growing up, someone told me, it just came to my mind, someone told me that, oh, as you get older, your cycle is not going to be as long, or you're not going to have as much pain. So that was in my mind at one point growing up. Again, people just saying things because we think we accepted the norm. We accepted heavy periods or painful periods as a norm. But anyway, for anyone who's listening, like what advice or piece of some sort of suggestion you can give them if you're just starting your period, or it doesn't even matter how old you are essentially, but you're menstruating and you have dealt with not only a heavy flow. Heavy flow meaning you're serving through multiple pads within an hour or two, but also you're dealing with severe pain or severe cramps. Like how does one know when it is time to see a physician? Because like you said, that was your last resort. You've tried the heating pads, you've tried the pain pills. So how do we know when it's time for us to go see a doctor to take, another measure, another step?
Well, honestly, I feel like it comes down to the individual, because it's how much can you actually manage and how much can you actually deal with. But at the end of the day, I just feel like if we're talking about a child and they just started menstruating, that should be word to their primary care doctor. That should be something that they reveal to their primary care doctor. So then you can have that conversation with your primary care to find out whether that's normal or abnormal. And then how can we deal with that? And then for an individual who is already, older and they're experiencing these things, I would say it doesn't hurt to pretty much ask. It doesn't hurt to have a conversation with a doctor or to even look up things online and just ask, because what we might think as normal is not normal. What we might think is a light flow is actually a heavy flow. So talk to someone about it. So like bring it up to the doctor, even like at your routines so when you go for a physical, or like, let's say you're going for something else, bring it up and be like, I just want to make sure that this is okay. This is X, Y, and Z that happens to me and how much I bleed through and so forth. And then, they will ask the more investigative questions to find out whether or not this is normal if this is normal for you as an individual, because everybody has different normals. That 7-day cycle is not normal, might be normal to me, but it's not normal to you.
Uh-huh.
And there's a lot of variation with regards to menstruation. And so I feel like just bringing up the question of whether this is normal and having it with your doctor. You don't even need to be experiencing any symptoms, just asking. But then what could be a tipping point is if you are experiencing, let's say you're having heavy periods and you're experiencing anemia symptoms. So that's a low blood count symptoms. So you're having fogginess, not able to think properly. You're having dizziness. You're not able to focus at work. You're dizzy, you're tired, you're fatigued. You feel like you're eating well, but nothing is really working and you're just constantly sleeping. Like those are pretty much signs of that there's something underlying going on, especially if it's around your period and after your period, that you've lost too much blood. So there's a lot of different things. And honestly, it depends on, I can't tell you a definitive answer because there's so many different, like, especially when you look at it with regards to how many different things can be present in a woman and how many different things can affect her menstrual cycle. So I would say just having that conversation with the doctor, whenever you go to see the doctor, just be like, is this normal? And you should be comfortable with your doctor to be able to ask them that. If you're not, then you're seeing the wrong doctor.
Yeah, listen, that is a fact. And I think it also comes down to being in tune with your body or paying attention. Because I remember for me that just the other day, let me let me tell you, a period will have you thinking so many different things, even if you're not doing anything out of the way. Because at one point, because right now, and this is probably TMI, but my period is, I have a 3 to 4 day cycle.
Mm-hmm.
But after day 2, between day 3 and 4, it's usually light. And then my last 2 cycles that I had, day 3 and 4, I'm like, come on, we're supposed to be over. Why are we still here with a heavier flow than normal, And I remember I got scared and I just made a note to monitor it and see if it was going to happen another cycle, which it did. I'm like, it could have been. I had to check me again. Everybody's not as educated with certain things, and that's okay. Or we're not really paying attention. But me realizing that, at the time I had other environmental or stressful factors that would have prolonged or caused me to have a heavier flow on those days when it's usually on the verge of being over. So it just comes down to being in tune, and like you say, being comfortable and open talking with your doctor. Because as you say, if you can't talk to your doctor about how you're feeling about any single thing, then you're seeing the wrong person. That doctor is not for you. Because if you gotta go and you're getting white coat syndrome, or you're being scared to be open and honest, then it could be the doctor, it could be a you thing as well. So then you also have to check yourself to ensure that you are being in tune and paying attention to what's going on with your body. Like, really, when we talk about self-care, we talk about taking care of ourselves. It means everything. It doesn't mean watching what we eat. It doesn't mean working out 15 times a week. It simply means everything from both internal and external as well. So that's something to think about. You decide what is normal for you and what is not, and be sure to communicate with your care provider to take the next steps.
I will tell you though that that bit that you're saying is very important, because when you do go and they're going to ask you, how long has this been happening for? Or when did you notice that it started? So it is very important to be in tune with yourself.
And I do want to ask, so we're going to shift gears. I feel like we've been a little bit heavy to some extent, but I really do appreciate you sharing your story, because I know there are a lot of people out there who are thinking, okay, I'm having a heavy period, I'm having cramps, is normal, let me get the heating pad, and then I have some sort of relief for an hour, 30 minutes to an hour, and then it's back to heavy flow, or severe cramping, or throwing up, and all these other symptoms, mood changing. So, we just got to be more in tune with our body. And I do appreciate you. And kudos to you for realizing that at some point in time, even throughout your teenage years, realizing that this is not normal. And I think it goes back again to our society, where we don't have these conversations enough. So then you're thinking your mom is taking care of you during that time, thinking, okay, she's been the best mom by taking care of her child. And you're just being there, okay, my mom is taking care of me, this is normal, let me continue. But then, as you say, you got to medical school, there's no way you can be on your cycle. Because like I was joking, even though it's not a joke, but I was joking with my sister the other day. I said, no, we as women, we only have one good week out of a month to be quote unquote normal. we essentially have 1 week out of a month. Like, can you imagine that there's 12 months in a year? Like, it's so crazy that we have known, like, the body goes through a lot. So can you imagine being a medical student and having this whole week of sick? It's a lot.
I honestly, that was actually one of the reasons why. So basically, I only had one good week out of the month where I was okay as well. So my thing is that I couldn't focus for a week before my period.
Right.
And then, so I was becoming very unproductive. And that was a part of the reason why I even went. It was just like, this needs to be under control. I cannot move forward with my life like this. I can't be going through medical school like this. And I'm going to be going to rotations and doing work all the time on my phone.
Right.
So it's just like, this needs to be resolved. Like this needs to be under control, not resolved, because it can't be fully resolved.
At least manageable, at least,
yes. Yeah.
At least that part. It's just recognizing and realizing. And it's for your mental health too, because everything, again, will come back to your mental health. Because if you can't perform the way you want, you have goals for yourself, it can take a toll.
Yes.
But I do want to ask, let's talk about some period products, because we know there's so many different period products out here in this world. What's your go-to period product?
The good old-fashioned pads.
I have a story about pads. I tried menstrual cup the other day. It's okay, but I'm old fashioned, and I remember that story I told earlier about me messing up my uniform in high school.
Mm-hmm.
Ever since that day, I call it period trauma. I'm not sure if it's an actual term, but it's my story. It's my trauma. It's my period trauma. And I remember ever since that day, I'm always gonna wear two underwear. Don't judge me. So I will be wearing two panties. And there was a point in time where I was doubling up on the pads. I had like two pads wearing all at once to avoid any sort of of leaking, because that's how paranoid I was. I kid you not. I'm old now. I'm in my I'm 32, and to this day I still wear two underwears.
You don't look like it.
Yeah, thank you. I will take that. But but I would be that person where I'll have a pad like this. One is going to either be vertical and horizontal, or it'll be all vertical. But it was a point where it was two pads I would wear along with two underwear and some tights. I know it sounds like a lot. You're probably thinking, "Oh my God, where's the air going? It's sweaty." No, it's not. So to this day, at this my big old age, I still do wear two underwear. And my mom would be like, "Tanya, why you have to have on so much clothes?" I said, "It's just two panties. Why is it so much clothes? It's not, but so sometimes if I'm talking to my sisters on FaceTime and they see me like, there you go. You say you're on your period. They just know because they know what's up. But so I am that old fashioned. I've tried tampons before because during probably my 20s or some point in time, because I was so traumatized of leaking, because I've had moments where I've messed up on my bed. So even to this day, I still have to spread an extra towel just in case, because you just never know. Because one, I feel like I don't even know, how do we sleep on our period? Like, what position are we supposed to lay on? Like, that's one thing. And then I still spread that towel, but there was a point in time where I was using tampons at night to kind of give me a little bit of a peace of mind. Okay, you know what? Whatever the tampon would absorb, it can go into the body, it won't be too bad, type of thing. Like that was my mindset.
Right.
It may sound crazy, but I'm just good old fashioned pads, because I found some pads and they've just never failed me. So I've graduated to the point now where I can wear one pad without, I don't have to double up. I wear one pad now when I'm going to work or when I'm going. Yeah, I've come a long way. It is a big deal because that trauma is real, and it wasn't that I was like teased or anything in school. It's just that fear of like, wow, that was an embarrassing moment for me. But thank God I had friends who they were already on their period, because I was usually the youngest of my friends, by a year or two, but still they had that, and it was like, it was a no judgment zone, but it just did something to me, and I never realized it because it was so crazy. Like, even when I would wear the pads after that incident happened, I would stuff toilet paper in my pads.
Oh.
As a measure of protection. Guys, don't judge me, because there are people around the world who are experiencing, period poverty, and they're having to use these items, like, the stuffing themselves with the toilet paper and these different things. But that's a whole different conversation. But these are things that people are actually doing. But I did that as a form of protection because I did not want to experience any sort of messing up. So, I've been graduating slowly, because after, I think when I left high school, I migrated from the whole, okay, you can do it without having your toilet paper and pads. You can just use two pads. And then, like I said, at night, I'll use the tampon so I can have some sort of peace of mind. But no, I'm about one pad now. So I'm still in my two underwears when it's that time, I will say. I have not gone there. And I've tried to use like a period panty as well, but my paranoia just would not allow me to be 100% comfortable with just freebleeding into the period underwear, even though it's created for that. But I'm not there yet. So yeah, good old fashioned pads.
I agree. But I'm really happy for you though, because that really is a lot of trauma there.
Listen, it's a trauma, and I'm over it. I cannot. So definitely, if you're out here, you can relate. Shoot me a DM. Let me know how you feel, because sometimes we're out here thinking, oh, we're all just getting along with our periods. No, we have some traumas. Whatever extreme things you got to do,
Yeah.
to protect yourself, you do that. But I think one last thing before we go, like, what position do you sleep in, or what is the ideal position that one who's seen their period sleep in? Because I feel like for me, I'm crazy. Like, I'm on my side, but I'm on my back, but I have to have a cushion in between my thighs, because for some reason it makes me feel like, okay, it's gonna have your legs slightly open. Listen,
Oh.
here's nothing. Here go this girl with a whole non-profit organization. I can educate. I'm going to be that advocate. I'm going to do everything. But I myself have my own trauma as it relates
I love the honesty.
to that. Yeah, I have my own little trauma. So I'm like on my side. I never in my entire life have slept on my stomach. I mean, I'm not really a stomach sleeper per se, but
Mm.
how do you see, like, what is the best position? Is there a thing out there that says, okay, this is the best position you should sleep in?
I have no idea. I honestly, I'm a sleeper on my side. I put my heating pad on my stomach. I sleep on my side and I'm good to go. But the thing is that I have to make sure that I have on something that's ensuring that the pad is on me, like
Right.
up
See?
on me. Like it has to be either a very tight underwear or like,
Mm-hmm.
tights to put it up or like pants that will hold it up. Like just to make sure that that doesn't happen. I don't really experience accidents. I will knock on wood for that.
Mm-hmm.
For me, I mean, for the most part, anytime that we're on our periods, I just remember that we all just ask each other, "Do you see anything? Do you see anything?" Like,
Mm-hmm. I still do sometimes.
so I think I've been okay. And like, if there is something right away, I'd know because I'm like, we're all just there with each other, and for the most part, I feel like women are very supportive of each other in that aspect, and so
Yeah, I
I'm
will
happy
say.
that you had friends and you went to an all girls school, even though like I mean there are bullies, so they probably would have reminded you of the incident. But I mean, if you had friends who could pretty much help you through that time, I think that's very important as well. So that's what was really good.
Yeah, that's good. Well, thank you, Dr. Michlene, for joining me here in the tea tasting room. I'm glad you were able to share your stories. Give me a round of applause for me graduating with my trauma as it relates to my
Yay!
period. I do want to thank you so much for taking the time for coming here. I did laugh, it was just interesting hearing your story. And, we're going to continue having these conversations because it needs to happen. And we're going to continue to spread the good word. So thank you for joining me here.
Thank you for having me. It was a blast.